Good morning, everybody. Thank you for the honor and opportunity of being here. I want to talk a little bit about, it's interesting that Laura talked about the journey with a purpose and so forth, and we'll talk about our journey at Novant in health literacy. And I'm going to start with the attributes, and I just laid each attribute out. And attribute one was leadership that makes health literacy integral to the mission structure and the operations. At Novant Health, how we did this is that health literacy is included in our 2010 and 2015 strategic plan. And that was a result of a lot of research that we did in talking to all the different entities in healthcare, be it our patient partners, physicians, providers, and health literacy rose as one of the top areas of opportunity. So we placed it in our strategic plan. It is included in our corporate dashboard through behavioral assessments and HCAP outcomes. And one of the areas that you will see in our dashboard in 2013 is that we will be asking our patients randomly throughout the year if they can tell us what their main problem is, what they need to do, why is it important, and if someone has asked them to repeat back some instructions that they have been taught. So that's reported at the corporate level and reported to our board. It is included, health literacy is included in patient education, our communications, our experience, safety policy procedures, and built into the EPIC health information system design. The other part that we did to meet this criteria is they hired me to lead health literacy in our organization in 2009. In terms of the attribute number 2, integrates health literacy into planning, evaluation measures, patient safety, and quality. We have met this criteria by training 19,000 providers and clinical staff throughout our organization. We tested their transfer of knowledge. So after they went through training, they were required to take a test. If they could pass that test, then they were counted as having been trained. So that was 100%. We then went out and asked, we assessed our staff if they could name the 3 questions of Ask Me 3, if they could use Teach Back, and 96% of them could. And we asked them to role play with us, and that was at 96%. So we actually validated the transfer of knowledge and the ability to apply it. Our patient education standards, we set in place standards in terms of the material, be written at a 5th grade level, and of a readability of 65% plus. And clear communication was one of the 5 behaviors in First Do No Harm. It is also a behavior in our standards for excellence, which is our patient experience criteria. So it's interwoven throughout all of our policies, our procedures, and the mainframe of Novant itself. When you look at attribute number 3, prepares a workforce to be health literate and monitors its progress. I go back to the fact that we did the training was completed. It is measured, and it's on the dashboard. And now we actively are looking at for changes in our HCAP scores. Number 5 is meets the needs of population within a range, or with a range of health literacy skills while avoiding stigmatization. This goes back to Dr. DeWalt's work and the others in this room of applying the universal precaution methodology in our organization. That has been implemented and embraced. And we have been trained to use simplified language, modified Ask Me 3. And what I mean by a modified Ask Me 3 is that we found that using Ask Me 3 was not successful. When we modified it so that it became the framework of our conversation, so that you have had a heart attack, this is what you need to do, this is why it's important, that worked. But asking the patients to ask those 3 questions didn't work for us. And then the use of Teach Back. I will tell you that I'd love to sit here and tell you that we use it 100% of the time and it's completely hardwired in our organization. I would love to say that, but that is not true. We are in the process. Number 6, use health literacy strategies in interpersonal communication and confirm understanding at all points of contact. We use the modified Ask Me 3. We use chunking and checking. That took a little bit for us to get that in place, but we've become much better at doing chunking and checking. And the use of interpreters. That has been a huge movement in our organization. We moved interpreter services to a corporate function, and have done massive amounts of training so that people understand when and how to access an interpreter. And so that has been an area of huge movement in the last year. Attribute number 7, provide easy access to health information and services and navigation. Come on, there we go. We are in the process of installing Epic. It is in our NMG practices, which is our medical group, and it is the first acute care hospital to go live in October. And there is a patient portal in there called MyChart that most of you are familiar with, and that has been a very powerful tool for us. We do have electronic patient scheduling now in our clinics, and this is an area of continued growth for us. Attribute number 8, designs and distributes print, AV, and social media content that's easy to understand. Once again, talk about the interpreters. And what we did with our interpreters is we trained them to be advocates for the use of ASPE3 and TeachBack. So not only are they interpreting, they are teaching our patients about ASPE3 and TeachBack in the hopes that they will use it in that encounter. Patient education material is now available in 15 languages, and we created something called the focus format, which is patient education going back to an earlier presenter. It is typically one page and is based on this. What is my main problem? What do I need to do? And why is it important for me to do this? And so we've simplified it. It's been very positive for us and very successful. Attribute number 10, communicate clearly what health plans cover and what individuals will have to pay for services. That is one of the board's questions earlier today. And we have been working very aggressively with our business office and our legal folks. And now all of our registration material as of April 17th, so next week, will be written at a 5th grade level. Simplified, we took a 5-page document that included the financial responsibilities and the informed consent, turned that into 2 pages with a lot of white space and some clear understanding. We have also put a product in place to estimate out-of-pocket expenses. And we have created something called Easy 3, which is a modification of Ask Me 3 for the business office. They actually developed it and are using it to explain benefits. So how did our journey at Novant begin? We started with a lot of research, and you can see it all listed above. Novant spent a great deal of time trying to understand what we were expected as a system. We covered the states of North Carolina, South Carolina, Georgia, Virginia. And so what did those communities need from us? What did our patients want? What did our insurers want? What did our providers and clinicians want? What were the driving forces? And so we did a number of processes to begin to determine that. When we brought that all together, 4 themes emerged. One was easy for me. Healthcare is complex, it's difficult to navigate, it's difficult to understand. So people are looking for easy access, easy understanding. People are looking for an authentic, personalized relationship. I always say no one likes to be number 33 of 80. They like to be Tom, or whatever you won't want to be Tom, but others. But authentic, personalized relationships, quality and safety, and voice and choice. And what they did is they hired coaches for each one of those themes. I am the coach of voice and choice at Novant, and I'm going to go into the voice and choice section now. So what happened is that I began in 2009 doing extensive research on health literacy and trying to understand what we could do to begin to narrow that gap. And Ask Me 3 and TeachBack emerged as the possible methods to address low health literacy, and we began to pilot those methods. We piloted them in 4 units in our hospitals and in 4 different physician practices. They covered different geographies, different ruralness or very urban, different types of practices, and the testing began and occurred over a course of a year. And what we found, to give you a feel for some of the findings, we found that Ask Me 3 and TeachBack really worked very well when we modified it. In the office setting, when we asked people to ask these questions, most commonly they did not, and at times they became irritated. And so we backed away from that strategy. How did we garner our support? One of the things that happened is that there was, because of the research, there's something called Senior Leadership Academy. And that academy began work on health literacy, and they engaged Dr. DeWalt to help in that conversation and work at Presbyterian Hospital in Charlotte in congestive heart failure. And what eventually happened were physician leaders were emerged, and those physician champions began to excite the rest of the organization. And as the work continued, it just continued to progress both in our physician leaders, in our nursing leaders, and then eventually, because of the results, we started to see a number of presidents of our hospitals become very interested. And as we progressed down the line, we actually had 2 presidents of hospitals that are actively vying to be the first to implement these strategies, which was really quite a wonderful turn of events. There was a lot of networking that was done. A lot of us went out and talked to different people, and I likened the work to being that of Johnny Appleseed. We spread a lot of seeds everywhere, and eventually we started to see them come to germination, and eventually the forest started to emerge. The healthy competition came about, as I talked about, with people wanting to be the first, and we started to implement system-wide, and the success led to a corporate mandate that Ask Me 3 and Teach Back be implemented throughout our organization. When that corporate mandate happened, the world changed because everybody was on board. It was an expectation. And I would say that that is one of the key learnings, is that when it is an expectation, it really does become a little bit more accepted, let's say that. So what did we do? The modified Ask Me 3 that we talked about based it on framing the conversation. And really what I'm talking about here is that in our profession, we do a good job of talking about what's the main problem, what do we need to do. The change was in covering the why. And once a person understands the why, they are much more likely to follow the plan of care or to be more active in the conversation to make a joint decision. So that was the Ask Me 3 side. Teach Back was then followed, and that was our implementation. We added in simplified language and asking people to sit and make eye contact, a few of those types of things. So what were the results? The chart you see above there is from our stroke center. And what we did is at the time of discharge, ruling out people who are cognitively impacted, we asked them what was their main problem, what did they need to do, and why was it important. And you'll see on the first 2 questions, those 2 came in at recollection with heavy prompting. The why question was slight recollection. It had not occurred. And when we used Ask Me 3 and Teach Back, we moved to full recollection across the board. So we saw significant movement across the board. The interesting piece here as well is I had trouble understanding why a patient who would have a stroke, who was in a stroke unit, has Stroke Navigator, Stroke Survivor Handbook, didn't know they had a stroke. And the answer is that people didn't tell them they had a stroke. They had a small bleed, they had an aneurysm. And so some of it was terminology. Heart failure. What we did, and this was one of the original studies I talked about, was we asked patients if they would take a test about their congestive heart failure. If you could pass the test, you could manage your heart failure. What we found out is the average score in that test was 38.5%. When we used Ask Me 3 and Teach Back, that score went to 85% and held at 85% for 2.5 years now. What that meant was a reduction in preventable readmissions of about 44%. So that was a significant change for us. What I did not expect was a significant movement in patient satisfaction. We saw everywhere that we tested Ask Me 3 and Teach Back that we saw satisfaction levels jump. In this particular case, they were at the 0 percentile. And when we trained them, they went to 100th percentile the next month. That's in the explanation of treatment and test. We also saw that in joint decision making. And we saw this replicated in every site that we tested. What were the barriers to implementation? I would say there were several. First was system capacity for change. Healthcare is evolving quickly and change is an issue. Consistent training of over almost nearly 20,000 people is difficult. And denial of the opportunity. Sometimes people just don't realize that they have not effectively communicated throughout their career. Sustaining the change, just quickly, is we're going to stay the course. We have dedicated facility points of contact in each of the facilities to help drive the hardwiring. We're embedding health literacy in our best practices, in systems and processes. It is a part of the patient-centered medical home. In the recognition process, it is intertwined and woven inside those systems. And we are doing the patient assessments by asking patients randomly at the hospital if they can tell us what their main problem is, what do they need to do, why is it important, and if they had somebody to use TeachBack. Our next steps is we are working on implementing the health literacy toolkit, and we are beginning with the assessment, and then from there determining what tools are necessary for the practices to use. We're beginning that process in the next couple of months as part of our patient-centered medical home. We will have 28 practices that will have assessments completed, and then we will then have PDSAs developed as a result of those assessments. Thank you.